Hello everyone. Today we're going to be going over a corrective exercise plan to go ahead and correct shoulder elevation during pushing and pulling assessments. So we're going to start off by inhibiting the upper traps, levator scap, and sternocleidomastoid muscle. Alright, so we're going to start off with the upper traps. Due to limited supplies, I'm going to go ahead and use a foam roller for this. Again, we're going to change the orientation a couple times so we can get that full fiber of the upper traps. So just follow along. So we're going to start off down here. And we're going to put this foam roller on our upper back portion / traps. And again, you can't really foam roll this area, but you can definitely have that pressure and hopefully get some trigger points. So here, you need to add pressure. Lift up your hips a little bit. Good, I already feel it on my left side here. And we're inhibiting that muscle for about 3 to 5 seconds. Good, and then you change the orientation of the foam roller so you can either rotate it upward or downward. Good. And same thing. Put pressure. 3, 2, 1. Perfect. That's the upper traps. Then we're going to move on. For the levator scap next. So for that muscle, again, its origin is on that, or its insertion is on that scapula. So it is a little difficult to get with a foam roller since it attaches that scapula and comes all the way through the neck. So here I'm going to use my hands. You can also use a tennis ball, a lacrosse ball, anything really when you're foam rolling on the ground. You just can't use a foam roller because, again, you're going to get in that cervical region and it's very uncomfortable. So here I'm going to use my hands. Let's see if you guys can see what I'm going to do. Good. So I'm going to hook my hands in here, right in there. And the way we're going to see where the levator scap is, we're going to go ahead and point our eyes to the opposite armpit region. Right, that's the way you stretch it. So in order to find that muscle, we're going to go in that direction just to find it and find that trigger point we need. Good, I found my muscle. Good, now we put pressure, 3 to 5 seconds. 2, 1, good. And again, you can move down that shoulder blade if you would like. Just for demonstration purposes, that's the only one we're going to do. Next is the sternocleidomastoid muscle. Now for that one, we're also going to utilize our hands. In this region, it's really hard to use a tennis ball or a lacrosse ball or anything of that matter. So we're definitely going to use our 2 fingertips of the thumb and index. So again, the sternocleidomastoid muscle activates when you turn your head the opposite direction, right? So if I'm focusing on the left, I'm going to look right. And again, we see that muscle pop up here. Good. So that's all we're going to do. We're going to rotate and hold that muscle down here at the clavicle. Good. Good, we're gonna hold. 3, 2, 1. Relax. We're gonna do that one more time. 3, 2, 1. Relax. Good. You can do that several times on each side. Again, you just want to do about 1 to 2 sets for about a minute or 2, and just focus on breathing and breaking up some of those adhesions. Alright, next we're going to focus on lengthening those same muscles. So the upper trap, levator scap, and sternocleidomastoid. So again, for your upper traps, it's up here in this region. So we're gonna do neck stretches. So I like to tuck my hand on the back side here. That way we can get a little bit of that shoulder drop and lengthening already. And here we're gonna gently pull on the head laterally, and we should be getting that upper trap. And I feel it right away. We're gonna hold this position for about 15 to 30 seconds. Good, and just hold, focus on breathing. And again, with each deep breath, you should be able to gently pull the neck more and more laterally. Perfect. That would be for the upper trap, and you do that on the other side as well. For the levator scap, it's going to be that same method that I used when we're doing that trigger point, right? So we're going to look in a diagonal. I like to use the armpit as a reference as to where you want to look. So that's exactly what we're going to do. Again, we're going to tuck our hand in our back. Now, our hand position is going to be also diagonal. And again, the head rotations we're going to make this stretch. So we're going to look into the armpit. Good. And gently pull down on the head. Good. And I can feel this lighting up. And hold it again, 15-30 seconds. 5, 4, 3, 2, 1. Good. And that, again, we'll do bilaterally to get that levator scap. Now, for the SCM, we're going to go ahead and do almost the same thing, right? So, again, since this muscle is activated when we look away, if we're trying to focus here on my left side, we're also, in order to stretch this muscle, we also have to put pressure in opposite direction, right? So here is flexing of that, and if we want to elongate that muscle, we gently pull back. Perfect, and you can get that stretch of that SCM. Good, hold for 15 to 30 seconds. Focus on breathing. 5, 4, 3, 2, 1. Good, so that's the lengthening phase in order to correct shoulder elevation. Next, we're going to activate a couple muscles that consist of lower and mid traps, rhomboids, teres minor, infraspinatus, and subscapularis. Alright, so we'll go ahead and do the mid and lower traps. Alright, so here I am going to use a broomstick. You can use a PVC pipe. This is just some tactile feedback. You don't necessarily need it, but since I have it, well, we're going to use it. And again, you can do this on a treatment table. I'm using it on the couch, right? But anywhere that's on an elevated surface where you can lay your elbows or at least your chest when you're doing this movement. So here, we're going to use this prop just so we can get some feedback as to how high we're going. So here, all we're going to do is basically lift the arms up. And again, this motion and angle is targeting primarily the lower traps, but you can also get the mid traps as well. So that's all we're going to do. We're going to activate this muscle for about 3 to 5 seconds. Again, we're using that 4-2-2 tempo, right? So focus on the eccentrics of the movement. So here, again, setting shoulders during these exercises is very important. So we're going to set our shoulder blades. Then move up. Slowly come down. Good. Relax. Shed our shoulder blades. Big chest. Five, come down. And again, it's important during this exercise that the client does not have their head up. This is just putting a lot of stress on their C-spine and keeping their head neutral, looking down towards the platform, towards the surface they're lifting up their arms from. Perfect. Now that's for the mid and lower traps. Next would be the rhomboids. So here, we're just gonna use scapular setting exercises. So retraction, right? So teaching the patient what retraction looks like and what they're trying to get, right? So here I'm gonna exaggerate a little bit, but this is kind of what we wanna see, right? So here I'm gonna round the shoulder posture, right? And we wanna engage those rhomboids, right? So we're gonna retract and depress, okay? So here, retract and depress, and we're squeezing in the middle, okay? And relax. Good. Here I'm rounded. Reach back, depress, and squeeze and engage those rhomboids. You also get the lower traps here, but again, that engagement is squeezing those shoulder blades together, really focusing on the rhomboids there, okay? Perfect. 3 to 5 second hold. Next, we're gonna do teres minor and infraspinatus. So during these exercises, it's very important to keep shoulder and scaption, right? And we utilize scaption. That way we're definitely engaging those rotator cuff muscles. So here I'm going to use a blanket. I'm just going to fold it up. Again, you don't want a very thick blanket or towel. Again, this is just so we can get some feedback. So we're going to put this underneath our armpit here. Perfect. Now, ideally, this is where I would need some tubing or some TheraBands, right? So here, this is where we're going to work with our external rotators, right? So the teres minor and infraspinatus. All right, so we have tubing. If we had tubing, right, tubing would be across from me, and we're going to pull in this outward direction right here. Pull out, and hold, make sure we're in a good posture, scapula set, scaption, and pull out. All right, and if we had resistance here, I'm going to use my hand just for some resistance. Good, and we're just going to hold here. 5 seconds or so, good. Shoulders are back. And now we're pulling outward, engaging the teres minor and the infraspinatus. Perfect. Now the next muscle we're gonna activate is the subscap. So again, this is internal rotation. So we had tubing, it'd be on this end, and we'd be pulling an internal rotation. So here we're gonna use our hand for some pressure. So here, set your shoulder blades. So I'm gonna come out a little more this way. All right. So we're gonna use our hand as pressure. We're just gonna pull inward. Again, this one doesn't work so well without tubing or a TheraBand, but this is for demonstration purposes. Come inward, right? Out here, pull inward. 3, 2, 1. Perfect. Good. And there we're engaging that subscap. So those are the muscles we would activate. Again, this is creating, or not creating, but stabilizing the medial border of that scapula, and also providing some stability to the glenohumeral joint. All right. So now we're going to go over some integration exercises that we can do. So here I'm going to demonstrate I's, Y's, and T's, prone rows without weight to start off, wall angels, and shoulder PNF patterns. So first, to start off with the I's, Y's, and T's. So these are perfect in a clinical setting, anywhere really, to be honest. But I'm gonna demonstrate it here on the couch. Cool. So we're here. We're on the edge of the couch. All right. And the most important thing before you do this exercise is setting your scapula, or both of them. So setting your scapulas. So here, we're gonna retract and depress, and we're gonna go up. And this is your eye. Here, move this table so you can see my other arm. All right. Here we go. So here, we set our shoulder blades, eyes, control downward, Y's, control downwards, and T's. Good. And then we repeat. You want to do about 3 to 5 reps in each one. 5 to 10 reps in each direction for about 3 to 5 sets. Again, we got to fatigue these muscles. Again, they're stabilizers that we're trying to correct, so we got to do a lot of reps, controlled reps. Good. So those are I's, Y's, and T's. I'm gonna demonstrate it one more time. Set your scap. I, Y, and T. And again, couple cues: keep your head in neutral, don't lift up your head, and make sure we're stabilizing that scap. Okay, perfect. Next, we're gonna do prone rows without weight, right? So here we're getting that retraction that we want. Okay, it's kind of difficult to do on this couch with both arms, so I'm gonna demonstrate one arm. Okay, so we're here, straight arm. Hopefully it's a little more elevated surface, right? But we're here, and all we're gonna do is bring that arm up and squeeze our shoulder blades together. Okay? Again, since we want to prevent elevation, it's important to set the scap. Okay? So we're here, bring back and depress that shoulder and roll. Okay? We don't want to roll up here, right, where that shoulder comes up. We want to bring it back here. Okay? It's a couple cues here. So again, shoulders neutral. Don't elevate the shoulder and come up here. We want to set the shoulder blade. Good. So we can get that proper activation there. Okay. So here again, we're trying to fatigue these muscles. So we're gonna do about 10 to 15 reps for 2 to 3 sets. Okay. So controlled. Remember those cues. Next one we're gonna do wall angels. So we're gonna come here. Perfect. All right. So for our wall angels, again, it's about setting the scapula and making sure that we're getting proper activation. Okay. So here, on our walls, slight bend in the knees, arms out to the side, touching the wall, right, like you're making a snow angel. So we're here, and now we're not going to do a lot of overhead stuff, but we're definitely want to make sure we engage those shoulder blades. Okay, so we're here. Set your shoulder blades. Again, we don't want to be tensed up here and doing this motion. We want to set the scap and then come down and squeeze in this position. Keep your shoulder blades tight to the wall. Make sure your low back doesn't come off the wall. And come down. Making sure your core is engaged. And the shoulder blades are squeezing, okay? So again, we're fatiguing about 10 reps here, 2 to 3 sets. Next, we're gonna go over PNF patterns. Now, these can be done on the floor, but for demonstration purposes, we're gonna do these standing up. Okay, So here again, PNF patterns are concerning or are done by focusing on shoulder diagonals here, okay? So here, we're gonna work on D1 and D2 PNF patterns. So here, we're gonna start off with our thumb and our fingers pointing at our hip, all right? And we're focusing on flexion overall. And then we're gonna come up to this other diagonal and work on extension, okay? So we're here, good, extend, and come back. Extension, flexion, extension, and flexion, okay? So that's D2, correct me if I'm wrong, I believe that's D2. So that's the exercise for that one. Now, again, we're working a couple extremes here. You can also use this with resistance if you had tubing, right? You can come out this way. Again, flexion and working on that extension, okay? The next pattern, which is D1, we're gonna start off in extension, right? And then we're gonna come to flexion, okay? So same side of the arm. We're gonna start off with extension, thumb out, fingers out, and we're gonna come across. And here again, the goal is to get that shoulder moving, getting those rotator cuff muscles stabilized, especially as our arm comes out into abduction. But we're also focusing on that scapular movement, right? So this is where the clinician can look at how the scapula is moving. So making sure that we set that scapula first. Again, as I mentioned, the scapula needs to be set. Okay, so again, here, again, no rounded shoulders, no elevated shoulders, which is what we're trying to correct. So again, retraction and depression here. And we're gonna start off here, extended, and then we're gonna come out in flex position. We'll come in a flex position and extend out. Come in and extend. Okay, perfect, guys. So again, this is a corrective planning exercise plan in the beginning stages. So here in my demonstration, we are demonstrating what I would do in the first 3 days. Again, so we can get proper muscle activation, and then we will slowly progress. I would prefer to slowly progress into more challenging integrative exercises. But in my plan here, day 4 and 5, we will use different exercises in the integration part just to keep things fun and also challenge the patient. So again, this is a basic plan to start off with. And as you can see, it takes about 20 to 30 minutes to complete. If you're really on it, 20 minutes. But again, everything's about setting that scapula when it comes to activating and doing the integrative exercises. Setting that scapula is very, very important, and inhibiting the proper muscles so we can get that correct firing pattern when we're trying to activate. And again, this is very important, and especially in overhead athletes, and is definitely something that should be done frequently. That way we can see progress and seeing if if a patient's in pain or what have you, and see progress in that, and use it as a rehabilitation tool as well, and not just corrective exercise. All right, guys, so hope you enjoy, and look forward to some feedback. Thank you.